happens to all your organs during pregnancy. From conception to birth, your muscles, joints and organs will be pushed and pulled and moved around. Your heart rate will increase as it works with the increase in blood volume. Not only is your outside appearance changing, but changes in your hormonal releases prompt all your internal organs to adapting in readiness for the work ahead. In the few days following fertilisation, your embryo makes its way to the uterus to implant in the uterine wall. In normal circumstances, something moving into your body, especially with unrecognisable DNA, would be treated like an unwelcome squatter, and your body's white blood cells would jump into action in order to attack this foreign visitor. So you would think that our immune systems would actually work against us. However, this is generally only the case in mothers that have a rhesus negative blood group, and they are advised to take anti-D. More on that in another video. In actual fact, the immune system adapts to protect both mother and baby. One of the first things to develop is what is known as the mucus plug, which helps to keep bacteria away from baby. As your baby grows, progesterone and relaxin are released to allow the uterine muscle to expand to accommodate your growing baby. On the flip side of this helpful hormone release, the hormones actually work on the digestive muscles too. Annoying as this can make them a little less efficient, and mum often ends up suffering with constipation. Not only does this impact things moving downwards, but you may find that a result of those hormones slackening off the lower esophageal sphincter, resulting in acid moving upwards into the esophagus, resulting in heartburn or more exacerbated pregnancy sickness. All these hormones are creating much more work for your liver and impacts its ability to move bile from the system. If this builds up, you may be developing a condition called intrahepatic pregnancy, cholestasis of pregnancy, and that can present with really bad itching. If this does happen, call your midwife. So far our uterus has grown, our bowels and digestive system have become a bit sluggish, our tummy muscles are providing us with heartburn and possible sickness, and our liver is working overtime. Anything else on the horizon? Well, yeah. Don't forget that expanding uterus is growing in an upward direction as your baby grows up and out of the pelvis. This in turn is pushing your diaphragm upwards, and as a result makes it harder for your lungs to fully expand. As a result, in your last trimester, you are likely to feel a little more breathless and take smaller, faster breaths to take in the right amount of oxygen. This growing uterus can also impact blood flow to our largest vein, the inferior vena cava. And if you lay on your back, causing your uterus to lag backwards, this can squish the vein and result in feeling dizzy. Hence, it's recommended that you don't sleep on your back. However, breathlessness can be a sign of anemia, which is why we take a routine blood test at around 28 weeks. During pregnancy, your blood volume increases significantly, and this process is aided by the release of hormones that help with red blood cell production. The kidneys also help further with this additional production by keeping back extra water. Not that you would recognise this, as most pregnant women are trotting to the toilet much more than usual. So, lots more blood, okay? What's pumping that around? Bring in your heart. Your heart is going to have to work that bit harder, so beats faster to cope with the extra workload. So the top and bottom of it is, ladies, that you are working really hard. All the more reason to rest and relax when you can. I hope you've enjoyed this video and will give us a follow. I also run regular live and interactive antenatal and postnatal classes. Just follow the links below.